Let me tell you a story about one of the athletes we had worked with here at Cohen Health and Performance. He had seen his doctor several months earlier for a knee injury that he experienced while exercising in the gym. Turns out he had nothing structural going on or significant that they found under imaging or anything like that. So the doctor said, take a couple of weeks off, slowly return back into the gym, and you should be fine to go. Unfortunately, months later, he came to see us frustrated that he's still dealing with issues, still having to modify all his workouts in the gym. Now, if that sounds like something you've gone through, perhaps what we're going to talk about today applies. And this story isn't very common for people that have had chronic knee injuries. It's very common for people to be experiencing pain for weeks, months, even years in many cases. And when it comes to athletes or people who just want to be extremely active in the gym, running, triathlons, what have you, one of the things we often see missing is what they do to help them return to those activities that are most important. So, when it comes to the activities that are most important to you, we need to think about the different positions, angles, and prerequisites that may be required from your knees in order to participate in that activity. If you are playing a sport that requires a lot of cutting, for instance, are you performing activities in your return to that sport that require your knee to have to generate, absorb, and create force in that type of angle? So here's an example of one of our patients that we've worked with actually performing a drill that teaches him to be able to absorb, generate, and just manage force in an angle that might be more consistent with actual lateral cutting, because your shin, as opposed to when you're running or jumping where it's vertical, is actually going to be angled when you're performing cutting or multi-directional movements. And when it comes to a lot of rehab, oftentimes it'll end when you're pain-free or when you're just able to get back to your activities of daily living. But are you actually stressing the knee enough to train it to be able to handle all the forces that you'll have to experience in your particular sport or activity? Now, the structures around the knee, such as the patellar tendon or the quad tendon, they have to deal with a lot if there's landing or jumping involved, or even if you just want to get into the gym and maybe be able to perform movements like squatting or split squats with some heavy weights. And the only way to train our body for that is to actually be able to do it. So here's a drill or a series of exercises that my colleague Dr. Kat is going through, where she just demonstrates drills that actually teach these tendons that surround the knee how to handle the loading that it will be able to, or have to be able to, do as you move forward. Now, if you're somebody who has had chronic knee issues and it hasn't gotten better despite resting, maybe despite foam rolling or whatever exercises you've seen online, I strongly recommend you contact us, because what we will do is we will schedule an evaluation for you, and at that session we will determine exactly why you are continuing to have knee issues. Why is stress continuing to accumulate in your knees that your body clearly cannot be able to handle long term, and say, what can we do to be able to make your body more prepared to be able to handle that, maybe even reduce all that stress that you're experiencing on a day-to-day basis, so that you can go back to enjoying and performing in the things that matter to you. If that's something you're interested in, contact us. We would love to be able to help you.